Hey, what's up guys? My name is John and I'm an emergency medicine PA. And in this video, I'm going to be talking about all of the onboarding, credentialing, documents that you need as a healthcare provider or as a physician to get started with your job, whether it is your first job, your second job. There are so many different things that go into your job application. It is insane. And I find that schools don't really do a great job of helping you. Luckily, most jobs have a point of contact who receives all the information and they help you get your onboarding and all of these tasks done. The credentialing and onboarding process can take anywhere from 1 to 3 months. Some facilities work faster at this than others. It is the process of obtaining all your documentation and getting you started, getting you rolling at a new job. These healthcare systems want to dot their I's, cross their T's, make sure that the insurance companies can charge for your services, make sure that you are indeed who you say you are. They don't want somebody who is not actually a doctor working at their hospital. They don't want someone who's not actually a PA working at their hospital and seeing patients. So I'm going to start with the easy, obvious stuff first, and then I'll get into the more obscure things that your employer will want for your onboarding and credentialing as a healthcare provider. To start, they want basic information and documents about you. That means a scanned copy of your driver's license and a scanned copy of your social security card or passport so that they can verify that you're able to work in the United States. If you, for some reason, lost your social security card, you can always request a new one from the Social Security Administration. They'll want scanned copies of your state medical license, your board certification if you already have obtained it. So for PAs, that would be through the NCCPA, and they will want a scanned copy of your active DEA certificate if they expect you to prescribe controlled substances. Now, if you do not have a DEA yet, but they require it for your first job, you'll usually have to contact them and they'll help you set it up, and they will likely help pay for it or reimburse you for it because it is quite costly to obtain. Likewise with your state medical license or your board certification, if you're still actively working on obtaining these things, you should notify them. Your employer will also want proof of your vaccination history, usually including things like a PPD, your last influenza shot, and even nowadays your COVID-19 vaccination status. For me, my pediatrician literally scribbled stuff on a blank sheet of paper, signed his name and dated it. So good luck to whoever wants to decipher that crap. My recommendation for you guys out there is to use your phone and scan your documents. If you have an iPhone, you could go to the Notes tab and there is a scan feature. It essentially takes a photo of your document and then you kind of fix up the edges and then you create it as a PDF, and you can send your PDF to something like a Google Drive, and you can either share access to these PDFs via the Google Drive to your other party and revoke access once they are done downloading those documents. That way you could keep your documents safe. But the best reason to do this is because it makes it 20 times easier to apply to a bunch of jobs when you have everything in one place. I use a password manager, so I don't need to, but if you have specific passwords, you could always make a Google Doc or Drive with these specific passwords for anything related to job searching and starting your new job. That way you have everything organized. Organization is key for this whole process. I was checking my email recently and noticed that the AAPA has an online tool just for this called PA Portfolio, which is actually free for all members, and you get to organize your career and employment paperwork into a secure online location. Employers will also want your CV or resume on file. They'll usually want 3 or 4 references, whether that is a professor, a preceptor if you're still in school, or your coworkers if you've been out in the workplace for some time. They may also want you to fill out a background check document, consenting to a background check, possibly paperwork that you will consent to a drug test. If you are working for a hospital system or a larger employer, they will want you to request privileges at their facility, anything from ordering x-rays, CTs, and ultrasounds to doing bladder catheterization, IND, splinting, IV access, intubation, and even conscious sedation. They will credential you for their facility. So all of those documents and things that I spoke about before, they will be covered by a lot of new jobs when you're applying. However, here are a few more obscure things that you need as a healthcare professional starting a new job or changing jobs. The first one is obtaining your 10-digit unique NPI number. Your NPI number helps identify you to healthcare payers, aka insurance insurance companies and for other healthcare providers. Every job will want to know your number, or they will want you to update your number's information if you are changing jobs. Every single provider has an NPI number. For instance, me, if you look up John Elkhoury in Pennsylvania, you will find my NPI number. This information is made public. Every single person has one. Every single person can be looked up through this system. You can obtain an NPI number very quickly through the National Plan and Provider Enumeration System, or NPPES as I call it, NPPES. It is a website where you can file an application and have a number within an hour. Before you go out there and make a number, I would look yourself up first and make sure that your employer did not make one for you, just so that there aren't any redundancies, and then you should create one for your first job, or you should edit your information in NPPES if you are switching jobs. Next off, for obscure documentation, I've had a few employers ask for you to submit a self-query from the NPDB database. The National Practitioner Data Bank is a web-based repository of reports containing information on medical malpractice payments and certain adverse actions related to healthcare practitioners, providers, and suppliers. It was established by Congress in 1986, and it helps prevent providers and practitioners from moving state to state without disclosure of previous damaging performance. National Practitioner Data Bank essentially helps improve healthcare quality, protect the public, and reduce healthcare fraud and abuse in the United States. My job asked me to go on to this data bank, pay $3, and do a self-query, which then verifies that I have no active malpractice insurance claims. If you are a new provider without much history, there'll be nothing to report. But if you do have reports, it's not a bad thing. It's not the end of the world. It is just that you need to disclose these things to your employer. So if you're telling them that you have nothing pending, you have no cases pending, and this database report says otherwise, you have some explaining to do. Whether your employer wants you to do this or they will do a query themselves, I feel like it's up to the job. And the next obscure thing that I would like to talk about is something called CAQH, or CAQH Proview. CAQH is the Council for Affordable Quality Healthcare. And if you go to their website, you still really have no idea what it is they do. Essentially, this is a database and credentialing portal for multiple private insurance agencies. And this is how they verify that you are a clinician. They claim that there is 1.6 million healthcare providers listed on this database. There is a ton of administrative and busy work behind the scenes to fill up and stay compliant with CAQH, and your information needs to be verified or updated every 90 days. Here's the thing, you will create a username and a password. Some jobs will do everything for you. They will fill out all of the rest of the pertinent information. You just have to provide them your username and password for the site, and they will want you to consent to that. There are jobs and practice managers that are managing hundreds of users and making sure that you're compliant in the database, because otherwise the insurance companies will not pay them. So it is more so in their best interest that you are on this database and qualified so they receive their money. If you are consenting to your employer modifying and editing your information in your CAQH profile, you should have a unique password. You should save it somewhere. It's one of those things where the information needs to be updated every 90 days. So if you want to go change it yourself, you have to be logging in every so often. I would not go out of your way and enroll in CAQH unless you are directed by your employer, because not everybody will need it. Your employer should kind of be the point of contact for what sort of information you should be entering into this database. Lastly, guys, for onboarding documents, if you want to get paid, you will have to fill out where your employer is to send money. So that usually involves entering in banking information or providing a blank check so that your employer could do a direct deposit. For your healthcare open enrollment and enrolling for your health insurance, these will be other forms you might have to fill out, in addition to things like a 401k or 403b documentation to create those accounts, and tax forms. We do not want to forget Daddy IRS and the IRS Mafia. So you will have to fill out a W-4 in regards to your tax withholding status if you are a full-time employee, or you'll have to fill out a W-9 if you are a contractor at the end of the year. So that covers a lot of things required for onboarding and credentialing as a PA, as a nurse practitioner, as a physician. If I forgot something or you guys have something extra to add, please share them down below in the comment section. You will be helping the community out immensely. If you guys enjoy content like this, go check out my other videos. And if you found this video useful, please hit that like button down below. Quick shout out to my VIP patrons on Patreon for directly supporting this channel. and making this video possible. And as always, guys, stay safe out there. Have a great rest of your day. Bye-bye.